All right, so we're diving deep today into some of the things that can go wrong with our hearts and how our blood moves around.
Yeah, it's fascinating stuff, and we have some really interesting research to dig into.
Yeah, so where should we even begin?
Well, I think it makes sense to start with the big picture. Understanding how things work when they're healthy helps us appreciate what happens when they go awry.
Right, makes sense.
Mm.
So what's the main theme for today's deep dive?
We're focusing on the heart and circulatory system pathologies. Basically, what can make these vital systems go haywire?
And the research you pulled together covers.
A pretty wide range, actually. We've got stuff on arteriosclerosis, the hardening of the arteries,
Hmm.
and then we'll delve into various inflammations that can hit the heart, endocarditis, myocarditis, pericarditis.
Inflammation of the heart. Sounds scary.
Yeah, it can be serious stuff. Then we'll move on to some fundamental circulatory disturbances like thrombosis, embolism, and of course what those can lead to, things like ischemia, infarction, even shock.
Okay, so we're talking about clots, blockages, and some potentially life-threatening situations.
Exactly. And we'll wrap things up with a look at coronary artery disease. It's super common, so understanding how it develops and manifests is crucial. And then we'll finish with cardiomyopathies, diseases of the heart muscle itself.
Wow, that's quite the lineup. So our mission today is to take all this complex information, break it down, and help our listeners understand what it all means, right?
That's the goal. We want to extract those key insights from all these interconnected topics.
All right, let's get started then. And first up, we've got arteriosclerosis. Now, I've always heard it described as the hardening of the arteries. Is that a good way to think about it?
It's a decent starting point,
Yeah.
but there's more to it. Arteriosclerosis is actually an umbrella term. It refers to a whole group of diseases where the walls of our arteries, those vessels that carry blood away from the heart, well, those walls thicken, they stiffen up.
Okay, so instead of being flexible and elastic like they should be,
Right, they become more rigid, less able to expand and contract with the pulsing of the blood.
and that's stiffening and thickening.
It ends up narrowing the space inside the artery, the lumen, so less blood can flow through.
And I'm guessing this isn't good.
Definitely not. It's like trying to water your garden with a hose that's got kinks in it. The water flow is going to be reduced, right? Same idea here. Less blood flow means less oxygen and nutrients reaching the tissues and organs.
So how many different types of arteriosclerosis are we talking about?
There are three main forms. We've got atherosclerosis, probably the one you hear about most often. Then there's Munkeberg medial calcification. And finally, arteriolosclerosis, sometimes called arteriolohyosis.
Atherosclerosis. That seems to be the one that's always in the news. You hear about it all the time.
It's a big one, no doubt. And yeah, people often use atherosclerosis and arteriosclerosis interchangeably. But technically,
Atherosclerosis is just one specific type of arteriosclerosis.
exactly. And atherosclerosis tends to affect the large and medium-sized arteries in the body.
So what's happening inside those arteries when someone has atherosclerosis?
Well, the key feature is a buildup of stuff. We're talking fatty substances, mainly cholesterol, but also complex carbohydrates, blood components, connective tissue. All this accumulates in the intima, the inner lining of the artery, and sometimes even into the media, the middle layer of the artery wall.
It's almost like plaque building up in a pipe, blocking the flow.
That's a good analogy. Over time, these deposits, they grow, they harden, and that's what leads to the thickening and stiffening of the artery wall.
Okay, so we've got this buildup of gunk in the arteries. What causes it?
Ah, that's the million-dollar question, right? There are a number of things that increase your risk, some more than others. Let's start with the big ones.
All right, the major risk factors for atherosclerosis.
High cholesterol. If you've got a lot of LDL cholesterol, bad cholesterol circulating in your blood, that's a huge red flag. Then there's high blood pressure. Hypertension makes those artery walls work harder, more prone to damage. And then metabolic issues, like diabetes, for example, or problems with how your body processes fats, lipid metabolism disorders.
So if you have diabetes or high cholesterol, your chances of getting atherosclerosis go up.
Significantly, yes. And we can't forget about smoking. It's terrible for your arteries, damages the lining, makes them more susceptible to this whole plaque buildup process.
It's amazing how many things smoking negatively impacts.
It really is. And here's the kicker. Having just two of those primary risk factors, say high cholesterol, and you're a smoker.
That combination quadruples your risk of atherosclerosis.
Exactly.
Yeah.
4 times higher than someone without any of those risk factors.
Yeah.
It's a powerful illustration of how these risks can compound.
So it's really important to manage those risk factors, even if they seem minor.
Absolutely. Early intervention is key.
Are there any other risk factors we should be aware of?
Definitely. We've also got what we call secondary risk factors, things like obesity. Carrying extra weight puts added strain on your heart and blood vessels. And then chronic stress. It's more than just a feeling. It has real physiological effects, can contribute to inflammation and those artery problems.
So managing stress and maintaining a healthy weight are important too.
For sure. And then there are things we can't really change, non-modifiable risk factors, like our age. As we get older, our arteries naturally become a bit stiffer.
Okay, so age is a factor, even if we're living healthy lifestyles.
It plays a role, and our sex. Men, unfortunately, tend to develop atherosclerosis a bit earlier than women, although that gap narrows after menopause. And then there's genetics. Some people inherit genes that predispose them to high cholesterol or other risk factors.
So family history is something to pay attention to.
Absolutely. And then there's a specific type of lipoprotein called lipoprotein, little a or LPA. Yeah, it's kind of like a cousin to LDL cholesterol, but it's even stickier, more likely to contribute to plaque formation. And the level of LPA in your blood is largely determined by your genes.
Okay, so those are the main risk factors. Some we can control and some we can't.
Right. And it's important to emphasize that atherosclerosis, this whole process of plaque buildup, it's not something that happens overnight. It's a chronic inflammatory process that unfolds over years, even decades.
So it's a slow burn. You might not even know it's happening.
Precisely. In fact, sometimes the first sign that something's wrong is a heart attack or stroke. But even in young people, you can often see early signs called fatty streaks in their blood vessels.
Fatty streaks, what are those?
They're basically the earliest visible lesions of atherosclerosis, kind of like little yellowish streaks on the inside of the artery wall. They're an accumulation of those foam cells, macrophages, that have engorged themselves on LDL cholesterol.
Foam cells.
Yeah, they look foamy under the microscope. These macrophages, they go into the artery wall to try and clear out the excess cholesterol, but they end up getting overloaded and stuck there. And over time, those fatty streaks, in some people, they can progress and develop into atherosclerotic plaques.
Plaques, those are the more serious problems.
Right. Think of a plaque as a kind of a bump or patch on the inside of the artery wall, made up of all that cholesterol, fat, calcium, cellular debris. It's got a core that's rich in lipids, the fats, and that core is covered by a fibrous cap.
And I'm guessing these plaques, they restrict blood flow even more.
Absolutely. And atherosclerosis, sadly, it's a leading cause of death in Western industrialized nations, responsible for about 30% of deaths in people up to age 65.
And that number jumps to 50% in older age groups.
Yeah, it's a major health concern.
Now, you mentioned earlier that even small amounts of narrowing in the arteries can have a big impact on blood flow. There was a specific law you referred to?
Right, the R-Hoch-4 or radius to the power of 4 law.
I'm not sure I follow.
It basically says that the flow of blood through a vessel is incredibly sensitive to changes in the radius of that vessel. So even a small decrease in the radius due to plaque buildup, for example, can dramatically reduce the amount of blood that can flow through.
So it's not a linear relationship. A small change in radius can have a much bigger effect on blood flow.
Exactly. Which means that even seemingly small plaques can have significant consequences. And we can't forget Virchow's triad.
Virchow's triad.
It's a concept that helps us understand what causes blood clots or thrombosis. And thrombosis, as you might imagine, can be a really dangerous complication of atherosclerosis.
Okay, so tell me about Virchow's triad.
Well, it identifies 3 main categories of factors that can lead to clot formation. First, there's damage to the blood vessel wall itself, like the kind of damage that atherosclerosis causes, right? It makes it easier for clots to form. Then there's abnormal blood flow. If blood's not moving smoothly, it's more likely to clot. This is why people who are immobile for long periods, like after surgery or on a long flight, are at increased risk of developing clots, especially in the legs. And lastly, there's alterations in the blood's composition itself.
So the blood might be more prone to clotting than usual.
Right. Certain conditions, like some cancers or inherited clotting disorders, can make the blood thicker, in a sense. And this can increase the risk of thrombosis. So Virchow's triad, it's a really helpful way to think about why and how these clots form.
It makes sense. If any of those 3 factors are out of whack, it can tip the balance towards clot formation.
So back to atherosclerosis. Are there any parts of the body where it's particularly likely to develop?
It can affect arteries throughout the body, but there are definitely some hot spots.
Great.
The coronary arteries are a major one. The coronary arteries, those are the ones that supply blood to the heart muscle itself. Right.
Exactly. And if those get blocked, that's what leads to a heart attack. Another common spot is the carotid arteries in the neck.
The carotids, those are the ones you feel pulsing on either side of your neck.
Right, they carry blood to the brain, so blockages there can lead to stroke. The aorta, the big daddy of arteries, is also susceptible to atherosclerosis, and it commonly affects the large arteries in the legs too.
Okay, so those are the main areas. Coronary arteries, carotids, aorta, and the leg arteries.
Right, and within those areas, there are certain spots that are particularly vulnerable, like where the carotid arteries branch or where the aorta splits to supply blood to the legs.
Why are those branching points more susceptible?
Well, it has to do with the way blood flows. At those branching points, the flow is more turbulent. It kind of swirls around.
So it's not that nice, smooth flow that you want.
Right. And that turbulent flow, it can cause little injuries to the artery lining, making it easier for plaque to start forming. And another factor is that cholesterol tends to accumulate in those areas where the flow is more disturbed.
Interesting. So it's kind of a vicious cycle. The turbulent flow creates the perfect environment for plaque to start forming, and then the plaque makes the flow even more turbulent.
Exactly. And that's how those plaques gradually grow and can eventually lead to serious problems.
So we've talked about the risk factors, the vulnerable spots, the general process of plaque buildup. But how does a plaque actually form? What's the step-by-step process?
It's a fascinating process, actually, and it all starts with an injury.
An injury to the artery lining.
Yes, the endothelium, that thin layer of cells that lines the inside of the artery. That injury, it might be caused by high blood pressure, by high cholesterol, by toxins from cigarette smoke, or even by infections. Whatever the cause, the injury disrupts the normal function of the endothelium.
So the endothelium, it's not just a passive barrier. It's actually actively involved in maintaining the health of the artery wall.
Right. It helps regulate blood flow, prevents clotting, and protects the artery from damage. But once it's injured, it can't do its job properly.
And that sets the stage for atherosclerosis to begin.
It does. It's like breaching a wall, you know? Once the endothelium is compromised, LDL cholesterol can sneak in. And then it gets oxidized, which basically means it becomes damaged. That triggers an inflammatory response. The body sends in white blood cells called monocytes to try and clean up the mess.
So the monocytes are like the cleanup crew.
Exactly. They go into the artery wall and transform into macrophages, which are cells that can engulf and digest things, like bacteria and cellular debris. But in this case, they start gobbling up the oxidized LDL cholesterol.
And that's how those foam cells are formed, the ones that make up the fatty streaks.
That's it. The macrophages get so full of cholesterol that they start looking foamy under the microscope. And they release inflammatory signals, attracting more macrophages and other immune cells to the area.
So it's like a snowball effect. The more inflammation, the more cells get recruited to the area.
Exactly. And all these cells, they release growth factors that stimulate smooth muscle cells from the media of the artery wall to migrate into the intima.
The smooth muscle cells, those are normally found in the middle layer of the artery wall, right?
Right. And they're responsible for the artery's ability to contract and relax. But when they migrate into the intima, they start producing collagen and other extracellular matrix components, basically forming a fibrous cap over the lipid core.
So they're trying to wall off the cholesterol, contain the damage.
In a way, yes. But this fibrous cap, it's not always stable. And over time, the plaque can continue to grow.
And that's when it becomes even more dangerous.
Yeah. As those plaques grow, they can become complicated. They can calcify.
Calcify.
Meaning calcium gets deposited in the plaque, which makes it hard, brittle, more prone to cracking. And if that fibrous cap ruptures,
That's when things can go south quickly, right?
it can trigger a cascade of events. When that cap ruptures, the cholesterol and other debris in the plaque core are suddenly exposed to the bloodstream. And that triggers the formation of a blood clot right there on the plaque surface.
So it goes from a slow, gradual narrowing to a sudden, potentially complete blockage.
Exactly. And depending on where that blockage occurs, it can have devastating consequences.
A heart attack, stroke, or blockages in other vital organs.
Right. And the location of the plaque really determines what kind of symptoms you experience. If it's in the coronary arteries, you might have angina pectoris, that classic chest pain.
Angina.
Yeah, it's a feeling of tightness, pressure in the chest, usually brought on by exertion. If it's in the leg arteries, you might have intermittent claudication, leg pain that comes and goes, especially when walking. If it's in the arteries supplying the intestines, it can cause abdominal angina, pain that often comes after eating.
And those were all signs of chronic narrowing, right? But if a plaque suddenly ruptures and completely blocks an artery.
That's when you have an acute event, like a heart attack or stroke.
Okay, that's a lot to take in about atherosclerosis, but I think we've covered the basics pretty well.
I think so too. We've got a good understanding of what it is, what causes it, how it develops, and what kind of problems it can lead to.
Great. So let's move on to the next type of arteriosclerosis, Munkeberg medial calcification. What's the story with that one?
This one's a bit different. In Munkeberg medial calcification, we see calcification and even ossification, the formation of bone.
Bone inside the artery wall.
Yeah, it's pretty wild, but the key is that it happens primarily in the media, the middle layer of the artery wall, not the intima like in atherosclerosis.
So it's a different layer of the artery that's affected.
Right, and it's most often seen in people with diabetes mellitus or chronic kidney disease.
So it's kind of a specialized form of arteriosclerosis.
You could say that. And macroscopically, the arteries affected by Munkeberg medial calcification, they can feel really rigid, almost like bone.
It's got that descriptive name, goose trachea arteries.
Yeah, because they have this ridged, bumpy appearance like the trachea of a goose.
Interesting. So what causes this calcification to happen in the media?
The exact cause isn't completely clear, but it's thought to be related to degenerative changes in the smooth muscle cells of the media.
Those smooth muscle cells are important for regulating blood flow, right?
They are. But in Munkeberg medial calcification, they start to malfunction. They might accumulate calcium. They might even start producing bone matrix.
So the artery essentially starts turning into bone. That can't be good for blood flow?
Not ideal, no. It makes the arteries stiff and inflexible. But it doesn't usually cause narrowing of the lumen the way atherosclerosis does. So the symptoms are often less severe.
Okay, so it's not as much of an immediate threat as atherosclerosis.
Right. But it can still contribute to cardiovascular problems over time.
Got it. And then the last type of arteriosclerosis, arteriolosclerosis. This one sounds like it affects even smaller blood vessels.
That's right. Arteriolosclerosis targets the arterioles. Those are the tiny arteries that connect to the capillaries, the smallest blood vessels in the body. It's sometimes referred to as arterial hyalinosis.
Arterial hyalinosis.
Yeah, a mouthful, right. It essentially means there's a thickening of the arterial wall, especially the intima, the inner layer.
And what causes this thickening?
Like a lot of things in medicine, the exact cause isn't fully understood, but it's thought to be a combination of factors, including endothelial dysfunction, similar to what we see in atherosclerosis. There's also some evidence that high blood sugar levels, like in diabetes, can directly damage the arterioles.
So this is another one that's linked to diabetes.
Very much so, and also to chronic high blood pressure, hypertension. And this thickening of the arterial wall, it leads to narrowing of the lumen, which reduces blood flow to the tissues.
Okay, so less blood flow, less oxygen, less nutrients getting to the tissues. What are the main consequences of arteriosclerosis?
Well, it can affect multiple organs. The kidneys are particularly vulnerable. The tiny blood vessels in the kidneys get damaged, and that can lead to nephropathy, which can eventually progress to kidney failure.
Kidney failure, that's serious.
It is. And arteriosclerosis can also damage the small blood vessels in the eyes, leading to retinopathy.
Retinopathy, that's a condition that affects the retina, the back of the eye.
Right. And if it's not treated, it can lead to vision loss or even blindness.
Wow. And those are just two examples.
There are more. It can also affect the heart, contributing to heart failure. And it can damage the small blood vessels in the brain, leading to cognitive impairment. And even in the feet, it can contribute to poor circulation, which can lead to ulcers and even gangrene in severe cases.
So arteriolosclerosis, even though it affects these tiny blood vessels, it can have really serious consequences.
It definitely can. It's often called a silent killer because it can progress for years without causing any noticeable symptoms.
So people might not even know they have it until it's already caused significant damage.
Exactly, which is why it's so important to manage those risk factors like high blood pressure and diabetes to try and prevent it from happening in the first place.
That gives us a really thorough understanding of arteriosclerosis in its various forms. And those are just the diseases of the arteries themselves.
We haven't even touched on all the things that can go wrong with the heart.
Exactly. We've still got endocarditis, myocarditis, and pericarditis to talk about.
Inflammation of the different layers of the heart. Let's start with endocarditis. That's inflammation of the inner lining of the heart, right?
That's it, the endocardium. And endocarditis can be caused by a number of things. Infections are a big one.
Infections of the heart. That sounds pretty serious.
It can be, yes. Bacteria, fungi, even viruses can sometimes cause endocarditis. They can enter the bloodstream, travel to the heart, and infect the endocardium.
And once they're in the heart, where do they usually set up shop?
Often on the heart valves. Those valves, they're constantly moving, opening and closing with every heartbeat, so they're particularly vulnerable to damage.
And if those valves get infected.
It could be a real problem.
Yeah.
The infection can cause inflammation, damage the valve leaflets, and even lead to the formation of vegetations.
Vegetation? Yeah, they're these irregular masses on the valve surface made up of bacteria, blood clots, inflammatory cells, and those vegetations, they can break off and travel through the bloodstream, causing blockages in other organs.
So like a clot that breaks off and causes a stroke, but in this case, it's a vegetation from an infected heart valve.
Exactly. That's one of the major complications of infectious endocarditis. It's called embolization. And those emboli, they can travel to the brain, the lungs, the kidneys, even the limbs, causing all sorts of problems.
So infectious endocarditis is definitely something you don't want to mess with.
It's not something to take lightly, no. But it's not just infections that can cause endocarditis. There are also non-infectious forms.
Non-infectious endocarditis.
Yeah, meaning it's not caused by bacteria or other microorganisms. Sometimes it's related to autoimmune disorders where the body's immune system mistakenly attacks its own tissues.
Autoimmune disorders attacking the heart.
It can happen, yes. And there's also a type called non-bacterial thrombotic endocarditis, or NBTE. It's often associated with certain cancers or other underlying medical conditions, and it involves the formation of these sterile vegetations on the heart valves.
Sterile vegetations, meaning they're not infected.
Right. They're mainly composed of platelets and fibrin, which are components involved in blood clotting. And these NBTE vegetations, while they're not infected, they can still be dangerous. They can also break off and cause emboli.
So whether it's infectious or non-infectious, endocarditis can lead to these potentially life-threatening emboli.
It's definitely a key takeaway.
And there's a specific form of non-infectious endocarditis that you mentioned earlier, endocarditis rheumatica. What can you tell us about that one?
Endocarditis rheumatica is a bit of a blast from the past. It's a complication of rheumatic fever, which thankfully is much less common now than it used to be.
Rheumatic fever, that's one that can happen after strep throat, right?
Exactly. It's an autoimmune reaction that can occur a few weeks after a strep throat infection. The body's immune system, in trying to fight off the strep bacteria, it mistakenly attacks the heart, joints, and other tissues.
So it's friendly fire, basically. The immune system gets confused and attacks its own body.
That's a good way to put it. And when the heart valves are involved, that's what we call endocarditis rheumatica.
And this was a major problem in the past.
Huge problem. Before antibiotics, rheumatic fever was a leading cause of heart disease in children and young adults.
And now?
It's much less common in developed countries because we treat strep throat with antibiotics. But in parts of the world where access to healthcare is limited, it's still a major concern.
So what happens to the heart valves in endocarditis rheumatica?
The inflammation can cause the valves to become thickened, scarred, and fused together.
Making them stiff and inflexible.
Right. And that can lead to either stenosis, where the valve opening is narrowed, or regurgitation, where the valve doesn't close properly and blood leaks backward.
And that can put a real strain on the heart.
It does. It can lead to heart failure, arrhythmias, and other serious complications.
Okay, so endocarditis rheumatica, it's a reminder that even a seemingly simple strep throat infection can have long-term consequences if it's not treated properly.
Absolutely. And that's why it's so important to finish a full course of antibiotics when prescribed, even if you start feeling better before you've taken all the pills.
Great point. So we've covered endocarditis, the inflammation of the heart's inner lining. What about myocarditis? That's the one that affects the heart muscle itself, right?
That's correct. Myocarditis is an inflammation of the myocardium, the muscular wall of the heart. And it can be caused by a whole host of things.
Like?
Well, viruses are a common culprit. Things like the Coxsackie virus, adenovirus, even the flu virus.
So sometimes those viral infections, they don't just stay in your respiratory system. They can actually spread to the heart.
Yeah, unfortunately. But it's not just viruses. Bacteria can also cause myocarditis. And sometimes it's triggered by an autoimmune reaction.
The body attacking its own heart muscle.
It can happen, yes. Certain medications, toxins, even radiation therapy can sometimes trigger myocarditis. And in some cases, we never really figure out the exact cause.
Idiopathic myocarditis.
Right. And the symptoms of myocarditis can vary quite a bit. Some people have no symptoms at all.
Really?
Yeah, it can be completely silent, but others might have fatigue, chest pain, shortness of breath, even heart palpitations.
And what's happening inside the heart when someone has myocarditis?
Well, the inflammation can cause the heart muscle to become weak and inflamed. It can affect the heart's ability to pump blood effectively.
So it can lead to heart failure.
It can, yes. And in severe cases, it can also disrupt the heart's electrical system, leading to arrhythmias.
Well, arrhythmias, those are irregular heartbeats, right?
Right, and some arrhythmias can be life-threatening.
So myocarditis is definitely not something to ignore.
No, it's not. But the good news is that most people with myocarditis recover fully, especially if it's caused by a virus.
So the heart muscle can actually heal itself.
It's pretty amazing, right? The body has an incredible capacity for healing. But in some cases, the inflammation can lead to permanent damage, and that can increase the risk of long-term heart problems.
So early diagnosis and treatment are important.
Absolutely.
And then the last of the heart inflammations, pericarditis.
Pericarditis is an inflammation of the pericardium,
Which is?
the sac that surrounds the heart. It's like a double-layered bag that encloses the heart, and it helps protect the heart and keep it lubricated.
Lubricated.
Yeah, there's a small amount of fluid between the two layers of the pericardium, and that fluid helps reduce friction as the heart beats.
Interesting. So what causes pericarditis?
Like endocarditis and myocarditis, it can have a lot of different causes.
Mm.
Infections, autoimmune disorders, even certain medications can sometimes trigger pericarditis.
Yeah.
And it can also happen after a heart attack, after chest trauma, or even after certain types of surgery.
So lots of potential triggers. And what are the symptoms like?
The most common symptom is chest pain. It's often sharp and stabbing, and it can worsen when you breathe in or lie down.
Sounds pretty uncomfortable.
It can be. And sometimes the pain radiates to the back, neck, or shoulders. And along with the chest pain, people with pericarditis might also have fever, fatigue, and shortness of breath.
And what's happening inside the pericardium when someone has pericarditis?
Well, the inflammation causes the pericardium to become irritated and swollen, and that can lead to a buildup of fluid in the pericardial space.
The space between the two layers of the pericardium.
Right. And if enough fluid builds up, it can put pressure on the heart, and that can interfere with the heart's ability to pump blood effectively.
So it's like the heart is being squeezed.
Exactly. And that can lead to a condition called cardiac tamponade, which is a medical emergency.
A medical emergency.
Yeah, if the pressure on the heart gets too high, it can be fatal.
Wow, so pericarditis is definitely something you don't want to mess around with.
No, you don't. But luckily, most cases of pericarditis are mild and resolve on their own with rest and anti-inflammatory medications.
That's good to hear.
Yeah, but some cases can be more serious and require hospitalization.
Okay, so we've covered the three main types of heart inflammation: endocarditis, myocarditis, and pericarditis. We've also talked in depth about arteriosclerosis, the hardening of the arteries. But there are a few more circulatory disturbances we need to touch on.
Right, we still got thrombosis, embolism, ischemia, infarction, and shock.
Those all sound pretty serious. Let's start with thrombosis.
Thrombosis is basically the formation of a blood clot inside a blood vessel.
A blood clot, also called a thrombus.
Right, and those clots, they can form in arteries or veins.
Arteries are the blood vessels that carry blood away from the heart.
And veins carry blood back to.